Hello, this is Dr. Anan Høst-Ragab from the Medical Affairs Department in Agendia, and today I will be presenting a walkthrough of the summary of results. The new summary of results pages are intended as a companion document to accompany your patient's official diagnostic report. It summarizes the most up-to-date and clinically meaningful information from the MammaPrint pivotal trials. It also includes a copy of the results specific for your patient all in one document that's easy to hand and easy to reference. The summary of results have been updated to include new data. This includes evidence from the MINDAC pivotal trial. We're also including supporting information and related clinical data on our new late recurrence low risk threshold. So on this slide, on the left-hand side, you can see the layout and format of the old summary of results, and on the right, this is the new summary of results pages that you can be expecting to receive from now on. What has changed in the update? As mentioned earlier, we are including data from the MINDAC trial on treated patients and presenting outcome report on endocrine therapy and chemotherapy use. And we also present data on untreated patients to give a simple and visual representation of the baseline risk of recurrence for your patient. We also present our late recurrence low risk new threshold, and if applicable for your patient, this will be added as a third page. Additional reference material includes the clinical risk algorithm as used in MINDAC, which is modified adjuvant online. And we believe our presentation of 5 and 10-year risk of recurrence, especially from MINDAC, is now presented in a more visual and easy and simple to understand manner. So we've updated content as well as format, and this has been refined based on the feedback from KOLs and physicians and patients. One thing to note is the official diagnostic report will retain the same data and appearance. So first, I'd like to give you an overview. Dependent on your patient's specific results, you can receive up to 3 summary pages. On the first page, we have patient-specific information and a personalized summary. So this includes MammaPrint and BluePrint results. It includes prognostic validation data for MammaPrint on untreated patients from the TransBig study, and includes clinical utility data on treated patients from the MINDAC trial. On page 2, we're including additional reference material. So here we've reproduced the clinical risk algorithm modified adjuvant online table that was used in MINDAC. If the BluePrint test was ordered in addition to MammaPrint, we provide information on molecular subtyping and pathological complete response in relation to neoadjuvant chemotherapy. And we believe these reference materials can aid in the more complex breast cancer treatment discussions that you have with patients. On the third page, this page is specific to if the patient received a MammaPrint low risk, late recurrence low risk result. So if the patient has a MammaPrint index of 0.355 or above, they're classified as late recurrence low risk. And this subgroup of patients has an excellent 20-year survival with limited or no hormonal therapy. So now I'm going to do a run through of a couple of examples of summary pages and do a step-by-step guide through the different points on the pages. I'll first present a MammaPrint low risk example. Here we can see a MammaPrint low risk BluePrint luminal subtype A that is also late recurrence low risk, or LR for short. And this patient will receive 3 pages. On the top of the first page, we can see in point number 1, this includes patient identifier and specimen information. On point number 2, we have the summary of results. In this case, it's low risk luminal type A. And in point number 3, this is elaborated and broken down into the MammaPrint result, which is in the green box, so low risk, And in the black box to the left underneath, we can see the MammaPrint index number. On the right-hand side, also in black, is the average 10-year risk of recurrence if untreated from the TransBig study. And in low-risk patients, this is 10% at 10 years. Because BluePrint was ordered, there's a BluePrint result in the blue box, and here it's luminal type. In point number 4, we can see the risk of recurrence in untreated patients shown in a graphic format. So it's risk of recurrence plotted against time. And we see risk of recurrence at 5 and 10 years. Those are the two green points. And the shading in between, the light green shading, that indicates the confidence intervals. Lower down on the page in points 5 and 6, we present data from the MIND-ACT trial. And this is the results of 5-year follow-up distant metastasis-free survival. And in point 5 first, we're presenting the results when clinical risk and MammaPrint risk are concordant. So in this case, you have a clinical low risk patient and MammaPrint low risk as well. So these results are concordant. And we're showing the DMFS 5-year follow-up values with endocrine therapy alone. You can see the patients do extremely well. They have almost 98% DMFS at 5 years. In point 6, we present the results from MIND-ACT when clinical risk and MammaPrint risk are discordant. So in this case, clinical high risk, but MammaPrint low risk. And here we display the results of endocrine therapy alone and endocrine therapy plus chemotherapy. And as was shown in MIND-ACT, the results demonstrate that there is a 1.5 non-significant benefit of chemotherapy between the endocrine alone and endocrine plus chemotherapy groups. Moving on to the second page. Here we have the clinical risk assessment table that was used in the MIND-ACT trial. And it allows for an easy, fast reference to determine clinical risk. Here on point 8, if BluePrint was ordered, we present this summary on BluePrint molecular tumor subtyping. And combining MammaPrint and BluePrint allows for the stratification of 4 different subgroups. These are luminal type A, type B, HER2 type, and basal type. And in the table, you can see that we've summarized for each subtype the pathological complete response. On the right-hand side, we have distant metastasis-free survival plotted against time and stratified by molecular subtype according to MammaPrint and BluePrint. And this is after neoadjuvant chemotherapy with 5-year follow-up. Moving on to the third page. Because this patient is not only low risk, but late recurrence low risk, they get an additional page. And as shown on point number 9, this is just summarized in the green box. And in the black box underneath, the MammaPrint index that is specific for this patient is displayed. In point number 10, we have an explanation on the late recurrence low risk threshold. So if a patient has an MPI greater than 0.355, they fall within the late recurrence low risk range. They have an exceedingly low likelihood of late recurrence of breast cancer with 20 years follow-up. This is with limited or no endocrine treatment. So looking over in point 11, we have displayed this in a graphical format. So breast cancer specific survival is on the y-axis against time. And you can see in untreated patients with 15 and 20 years follow-up, there is a breast cancer specific survival of 94%. While in tamoxifen treated patients, this is at 100% at 15 years and then 97 at 20 years. Moving further down on the page on point 12, displayed here, the same data is displayed in bar form in an easy visual way. And the same data is that in untreated patients at 20 years follow-up, with breast cancer specific survival of 94%. And in the tamoxifen-treated patients, there is a non-significant additional benefit, taking it up to 97% with 2 to 5 years of tamoxifen treated. And one thing to note in this trial is that 65% of patients actually receive tamoxifen for only 2 years. So there is no significant additional benefit of tamoxifen in MammaPrint late recurrence, low risk patients. So this is the end of the example for the low risk patients. I'm now moving on to the MammaPrint high risk patients. And here, again, we have the patient-specific information in point number 1. Moving down to point number 2, you can see the summary of the result, which is MammaPrint high risk. And if you look at 3, this is indicated in the blue box. The MammaPrint index is in the black, and the average 10-year risk of recurrence in untreated patients is displayed underneath, and that's 29%. Over at point number 4, we have the graphical representation of risk of recurrence against time, and we have the point at 5 and 10 years follow-up. And again, the shading represents the confidence intervals. And this is taken from the TransVIC study. In points 5 and 6, just like the low risk, we're displaying results from the MINDAC trial. In point 5, this is when clinical risk and MammaPrint risk are concordant. So in this case, you have high-risk clinical and high-risk MammaPrint. And we're showing DMFS with 5 years follow-up for endocrine therapy and chemotherapy. And you can see here it is 90.6%. In point number 6, we displayed the results of the MINDAC trial based on a discordance between clinical risk and MammaPrint risk. So here it's clinical low risk, but MammaPrint high risk. And with 5 years follow-up, DMFS is 95, but for endocrine therapy alone, and 95.8% for endocrine therapy plus chemotherapy. So there's a non-significant 0.8% difference and non-significant additional benefit of chemotherapy. These are the examples that I wanted to run through with you today. I want to end to encourage you to download the new summary of results in addition to your official patient diagnostic reports. And this can be done by the physician's portal. For further information and support, please look at the website indicated on the slide right now. And I can also tell you that there will be an overview brochure that will be produced and available for your reference as well. If you have any further questions, please don't hesitate to contact your local Agendia representative or our customer service team at the contact details indicated here on the slide. I would like to end by thanking you for your attention, and thank you very much for listening to this webinar with me today.